Hello, this is Dr. G. Narenthiran. Welcome to this tutorial on minimization. This is the method of randomization. This method is somewhat controversial, whether some question whether this is indeed a true randomization. However, I will explain minimization in this tutorial. The aim of minimization is to ensure that patients are randomized to control and to the test groups in a random way, but also their risk factors are also the patients are randomized, so the risk factors are also balanced in each group. So let's say these are our patients, and A is the control and B is our test. What we want is to allocate these patients in a random way. However, the patients have risk factors that gives different risk for the disease. And although we are, for the test group, we are introducing a new treatment, but because these patients have a, let's say this red, the dots with the red, they have a higher risk of the disease. What we want to make sure is that we have got equal number of patients with red and blue in both these groups, so that not only the patients are randomized, but patients are randomized in a way that their risk factor, patients with the randomized patients have similar risk factors. You will understand it a bit better in a second. So let's say that we have got all the patients, and first we can start with randomization. So I'll click on randomization. So the first patient is being randomized to treatment A. The second patient who has less risk of developing the disease but still having the treatment, and we can randomize this patient as well, no problem. That's great. So the question is, what do we do with the next patient? In a normal randomization, we will randomize this patient, and the process, whichever we flip the coin or use a computer, that decides whether the patient goes to treatment A or treatment B. But in minimization, it's different, because in minimization, what we look to see is that here we have got already one red, there's no reds here. So because there's one red and no red here, and the next one is red, what we do is, rather than randomizing, we allocate this red to this team B. So I'm going to click here, and it's going to allocate rather than randomize. So the next patient is also red, and what shall we do? There's one red here, there's one red here, so there are equal red, so we can randomize this patient, and let's see what the randomization does, and that's putting the patient to the control treatment A group. Now the next patient is blue, there's no blue here, there's one blue here, so what shall we do? We want to make sure that these two groups are balanced. So rather than randomizing this patient, what we do is we allocate the patient to the team or the group A, or the treatment A, which is our control. So there you go. Now we have got another blue patient, or patient with a certain risk factor. And here we have got one blue on treatment A, we have got one blue in treatment B. So because there are equal numbers of blue on either side, we can randomize this patient. So you see, in minimization, we start with the randomization, then as the randomization goes, we try to keep the balance in each group, with the patients with equivalent risk factors being in both groups in an equal measure, then we use allocation to help to balance those groups. I hope you found this tutorial useful. Thank you for your attention and wishing you a good day. Bye for now.